Hi everyone, how are you? So I have a really interesting case that's gonna show you a drastic difference of its appearance on two-dimensional image versus the three-dimensional CBCT scan. So as we look at this endodontically treated tooth number 15, how would you assess the bone loss or the apical radiolucency? Try to draw the extent of that radiolucency as best as you can um, in your head. Like, how would you draw it? Well, if I had to do it, I would say I'm clearly seeing radiolucency in this area, and this would be the approximate, perhaps the border of that radiolucency. So let me ask you another question. If you didn't agree with me, like what was, what was your extent of the lesion? Um, and what about the alveolar crest? Do they appear intact, or is there a big defect along the alveolar crest? Now, you've all had a chance to kind of visualize this radiolucency. I'm going to show you how it actually appears on cone beam CT. Please keep in mind that this periapical radiograph that you're seeing now and then the cone beam CT that I'm about to show you were taken on the same date. So they were taken on the same date, and here's a cone beam of that tooth. I've already oriented in a way that pretty much demonstrates what I want to show you. Look at this sagittal view. That periapical bone loss that you saw previously actually extends all the way through the root, along the root surface to the alveolar crest. So this is an endopareo lesion. Again, that bone loss involves the full length of the tooth or the root. You can also see that bone loss as well. Here's the alveolar crest. There's that defect, and it extends all the way to the apex. And here we can see that again. So knowing how big this defect is, how do we make a sense out of that on two-dimensional image? Sure looks like there's a lot of bone here. Sure looks like the alveolar crest is intact. So I think the lesson here is that two-dimensional image is very limited, and it is limiting. So assessing periapical infection or assessing accessory canal and MB2 canal and whatnot, it's just doesn't provide the enough information to make an accurate diagnosis, in my opinion. And I hope this example clearly addresses the power of cone beam CT, addressing the limitation of two-dimensional image. So, well, thank you everyone for your attention, and I will see you in the next video. Thank you.